Hello, friends. Dave Bjork here, lung cancer survivor, patient advocate, and the Research Evangelist. And welcome to the Research Evangelist Podcast. I'm coming to you, as always, from Boston, Massachusetts. And, you know, the Greek meaning of evangelist is bringing the good news. And I like to think that I'm bringing the good news by talking with people in life science who are doing amazing work. I call them brilliant but not famous. And, of course, the irony is that they are brilliant and well-known and respected in the field, in the communities they serve. But my next door neighbor might not recognize the name. But they really are amazing. I love sharing their stories. And I believe in serendipity. So I hope that some good things will happen by me sharing these stories with all of you and with the universe. So today I'm really excited to have on my show Dr. Lauren Groner. Dr. Groner is hi Lauren, is a radiologist specializing in cardiothoracic radiology. She's an assistant professor of radiology at Weill Cornell Medicine and an assistant attending radiologist at New York Presbyterian Hospital, Weill Cornell campus. Dr. Groner graduated from Michigan State, go Michigan State, where she earned her Bachelor of Science in Physiology. She then received her DO degree at Michigan State University College of Osteopathic Medicine. That's a mouthful, but Lauren, welcome to the program.
Thank you so much for having me, David. I am delighted to be here. And I had so much fun talking to you in October at the Czech conference. So it's just so nice to come together again.
It's awesome. Well, it's great to see you. And we did meet recently. We've known about each other for a while, but we met in person in the lobby of a hotel in Chicago when we were both at a conference together. And thank you for coming up to me and recognizing me, because it was really awesome that we started this conversation. So
I'm glad you didn't think I was your stalker. Yeah.
Exactly.
I know you.
Oh, it's so funny. No, I know all about you too. So anyway, let's start by having you tell us about yourself, Lauren. Tell us about the younger version of yourself that led up to where you are today.
Yeah, thanks for asking. So I grew up in the city of Detroit, which I think gave me kind of a unique perspective. Detroit has this very layered history of like resilience and a deep culture that influences, I think, anybody who calls it home. It is one of the most historically segregated cities in the United States. So I think I was sort of privileged in a way to have this firsthand look or view at how housing and educational and economic opportunities really differ by neighborhood, and how policies shape life expectancy and opportunity, the consequences of disinvestment and discriminatory systems. But I think something I also remember very fondly is kind of growing up around stories of automotive innovation and musical revolution. I don't know if you know, but Detroit is the birthplace of both Motown and techno, and I love both. So I think it's very cool to be from a city that really kind of has this rich, creative, and globally influential culture and cultural identity. Detroit taught me grit, David. I am tougher than I look. Believe it or not, I have a twin sister who's even tougher. Do not mess with her. I don't think I don't think anyone would call us wallflowers, but I think at the same time, Detroit also taught us both empathy and this deep appreciation of community. At an early age, I was sort of lucky to recognize structural barriers while also kind of understanding people's capacity to like rise and rebuild and create something better. So that whole combination is kind of how I see the world and how I approach my work.
That's amazing. Thanks for sharing that, because you're such a nice person that, you know, people would not know about the grit and the background. And thanks for putting that all into context. I think that's really cool, because I had a similar, when I went to college, I went to UPenn in West Philadelphia, and I wanted that experience because I didn't grow up with that diversity in the town I grew up in. So I can totally appreciate, what you're saying. And so Michigan State, so you went to Michigan State. So I have to ask about Michigan State, because I think I told you I'm a Michigan State basketball fan because I love Tom Izzo. But how's that dynamic play out in your family?
Yeah, good. So it's a fun dynamic. I also am a huge Tom Izzo fan. I think most people who love college basketball, are very fond of Tom Izzo. But my sister and I, we are the only ones in our family who went to Michigan State. It was the only college I applied to. I got in pretty quickly, actually, into the pre-law like honors college or program, which is pretty funny because obviously I'm a doctor now. But my whole family went to the University of Michigan, and my dad lives in Ann Arbor now. And so the thought of kind of going to school, even though University of Michigan is wonderful, and I always root for the Wolverines when they are not playing the Spartans. But I kind of just needed a little, when you're a teenager, you're like a little bit more defiant and you love your parents, but you don't want to spend, you don't necessarily want to go to college where you live. And so Michigan State was a really good fit, I think, for both of us. So it's a fun, competitive dynamic, but all very friendly.
Very cool. Very cool. And you mentioned this pre-law. And so it makes me curious to understand, how did you decide, or when did you decide that you wanted to go into medicine?
So, just to kind of give you some background, so I come from a family of lawyers. My parents' social network really primarily consisted of like doctors, lawyers, judges, politicians, and some financiers. I'm good at spending money, David. I am not good at saving money. So I think the financial, career for me was not an option. I never wanted to be famous, and I really value my privacy. And so being a politician was kind of also off the table. And so then that kind of left doctor or lawyer. I think there was this sort of expectation in my family that whatever we did, and again, I'm a we because I'm a twin, whatever we did was, we should work hard and we should do something that sort of contributed in a meaningful way to improving the lives of others. And other than that, those are sort of the values that were instilled in us. And my parents just kind of taught us not to uphold or accept systems as they are if they don't work equitably or justly for folks. And so I think it's funny. I remember when we were in preschool, we had like picture day, and my sister and I, they gave us these little cards, and at the bottom of it, they had asked us like, "Oh, what do you want to be when you grow up?" And I said, "I want to be a doctor so I can help people." And my sister had said, "Oh, I want to be a lawyer so I can help people." And then who knows, years later, when we applied to Michigan State, my sister had gotten into the same version of like the pre-law honors college, but she got into the pre-medical kind of like honors program. And the first day of orientation, so I was at this pre-law program and she was at the pre-med program, and we were just like, we are in the wrong place. And so we switched, and now, she's a lawyer, she's a criminal defense attorney. I have so much respect for her. She is just like, am I allowed to say badass on your podcast? I don't know, but she is all those things, and she works so hard, and I'm just so incredibly proud of her. And now I'm a doctor, and I think we really made the right decision. So it's kind of how we got here.
Yeah, and in my show, my thing is let it rip. So I think it's great.
Excellent.
No worries about that. So you studied, you became a DO, and you studied osteopathic medicine, and I love that, by the way. But could you just briefly explain the difference, or why the uniqueness of the program that you went through?
Yeah, so I always, I really wanted to go to Michigan State. I had a great experience in undergrad, and I knew a lot of people, friends, and other people in my network who were going to medical school and going to Michigan State University. And so I knew people who were both in the osteopathic program and also in the allopathic program. I applied to both, I got into both. And I really loved, the people I spoke with at the osteopathic program were just like thriving. And they were all people who kind of had a really well-rounded life and perspective, and kind of saw, the whole person in the way that they practice medicine. And that really resonated with me. I think, as an osteopathic, pre-medical student or student doctor at Michigan State, we took all of our classes with the allopathic program, so for the first 2 years, and then you have additional training in osteopathic manipulative medicine. And so it was very cool how they really kind of reinforced this mind and body and holistic approach. And that is something that I thought was really cool. And I think I made the right choice. It's funny. In the Midwest, I think DOs are much more prevalent. It certainly got a little bit more challenging. I think that's changed a lot. But when I was applying for residency, certainly on the East Coast in particular, being a DO wasn't as popular. But I think we're seeing a shift now. And I think a lot of programs, kind of incorporate both DOs and MDs. And I'm really proud to be a DO. I had exceptional training from Michigan State. And, I think look back and I think I made the right decision.
That's awesome. And being a fellow Midwesterner, maybe that's probably why I understand more about it than maybe the average person does, because maybe it is more prevalent in the Midwest. So now I'd really love to sort of fast forward to the work that you're doing, and let's start by saying, how did you choose that specialty? And then kind of tell us about, what is a day like as a radiologist?
Yeah, thanks for that question. So, I kind of stumbled upon radiology accidentally. It was not something at all that was on my radar. I think I remember in my late in my third year of medical school rotations, I ended up doing a rotation in radiology and absolutely fell in love with it. I really kind of loved this idea of being at the intersection of diagnosis and treatment and innovation. And also, if I'm being totally honest, I'm somebody who feels very deeply and I'm extremely empathetic. And so I think also the chance to kind of have some sort of buffer between what can be sometimes a really challenging and kind of sad practice of medicine. I think that was also really helpful for me so that I didn't get so overwhelmed and I could really just kind of concentrate on doing the best I could for patients and providing patient care. And so I applied for radiology. I ended up matching into a program in New Jersey at Atlantic Health System. And I enjoyed it. I think, actually, believe it or not, the reason I went into chest radiology is a couple of things. Number one is I felt really confident in all of the kind of other aspects of radiology, and chest was sort of my weakest area, number one. And also I loved cardiology and I really liked cardiac imaging, and those two typically go together. I mean, most people who are cardiothoracic radiologists do both cardiac imaging and chest imaging. And so that's what I do as well. And yeah, I ended up going into a fellowship in cardiothoracic imaging at Weill Cornell. And then I stayed on as faculty, and I really enjoy it a lot. And I have, come to really love the work that I do with lung cancer screening. Maybe we'll get into this a little later, but my career path did kind of take an unexpected turn in terms of some of the research that I do. But that's sort of how I ended up in cardiothoracic imaging.
Yeah, well, and you mentioned the sort of as being part of a team and being that sort of buffer. And you may or may not know this, but in my experience, my personal experience, I got pneumonia a few times, and it wasn't until a radiologist eventually said, you should get a CT scan, because it was happening in the same spot. And so that's how they actually discovered that I had a tumor in my lung. So tell us about the teamwork of how you fit in with because it feels like a team effort where you work. And so talk to us about that.
Absolutely. And I just want to reinforce what you just said, though, about your experience where you had this recurrent pneumonia. And actually, one of the things that we do that's really important as radiologists is when we see something that looks like pneumonia, we always recommend a follow-up within 4 to 6 weeks for exactly, to identify cases like yours, David, where we want to make sure that it's actually pneumonia and not something like lung cancer or, something else that's more of a chronic issue. And so I really appreciate you bringing that up. And then in terms of the teamwork, I think, it's funny. I was just on another podcast and I talked about this. Radiologists, I think, get a bad rep as sort of the hermits, kind of like pathologists and radiologists are both considered hermit professions where we just kind of stick to ourselves. And actually, I think that couldn't be farther from the truth. We are so in, the team approach to healthcare. And I would say we're probably kind of like the hub of the wheel. If you think about like a wheel and like we're at the hub of it, and then all of the other professions and patients and everyone are kind of like the spokes of the wheel. I would actually probably put patients at the center too, though. And so I know, the thoracic oncologists, pulmonologists, cardiologists, internal medicine physicians, all these providers who order imaging studies and provide care for the patients whose scans we're reading. Like, we are all a team, and most of us have each other's numbers. And so if something comes up, I can give them a call. And it's the part of my work that I just so enjoy, because as a twin, I was like born with a buddy. So I'm just like a team player. Like, I just love to be with people, around people, working together. I also think it's how you learn. Like, I don't know. I mean, you do these podcasts, which I think is so cool, and you bring in all these other perspectives and you offer your perspective, and you do that in your work throughout. And I love that, because I think that when we start to get tunnel vision, that's when we can get really dangerous, right? Because, as a doctor, I never pretend that I know everything, and I always welcome other perspectives and insights and teaching and things like that.
I love that. I love that approach and that philosophy, because I agree. I mean, I love the team efforts. I don't know everything, and I always laugh when people they come across as know-it-alls, because they think they're know-it-alls, but they don't know everything. And so you can only benefit by getting knowledge from other people of a different perspective and different specialties. Special, because we're all different. We're all special. So.
We are all special. That is so cute. We sure are, David.
Yeah. Well, I think everyone, I mean, I know what I'm good at and I know what I'm not good at. And so, and I'm always very clear about that. It's like, oh, Dave, go make me a spreadsheet and the formula. No, I don't know. My brain explodes if I have to do that. So I know, but I know what I'm good at. So we'll leave there. You mentioned your research work. I'd really like to, let's pull that thread out. Cause I know that your research interest is in lung cancer screening, and health equity. And of course, those align very well with my research interests as well. So I'd love to have you tell us about what you're really passionate about.
Yeah. So I kind of stumbled upon this like alternate career path, if you will, or extended career path accidentally. It was about a year into my first year as an attending, and I was just sort of frustrated by how low our lung cancer screening rates are. My grandmother died of lung cancer when I was 10, and so that was back in 1995. And now we have low dose CT screening, which can detect lung cancer at an early stage, right, when it's easier to treat and cure. But at the time, and even now, most people just are not getting screened. And so, the other part of this is, I think there were sort of obvious racial and socioeconomic disparities in terms of who gets screened and diagnosed early and treated, and who survives lung cancer. And all of that was kind of impossible to ignore. And so I kind of felt like, I remember it was during the pandemic, and I had friends who were like, oh, and I think all of us kind of took a step back and asked, like, are we doing enough? And is the work that we're doing meaningful enough and helpful enough to sort of all populations? And I remember friends of mine saying, like, well, you must feel really great because the work you do is so impactful. And I thought about it, and I just kind of felt like I actually was not doing enough. And I had like lost my sense of purpose. Just really feeling like there were, I was upholding the system that worked for a privileged few and then failed so many others. And so I started thinking, like, what are ways that I can help everybody more than I am now? And so I was like super eager and enthusiastic, but I had like absolutely no formal research training. This was like never something I thought I was going to do. But I reached out to a couple dear friends and also mentors of mine in the Department of Radiology, Doctors Joe Osborne and Kemi Babugemi, and they connected me with this just like absolute rock star physician scientist, Dr. Erica Phillips, who is the co-associate director of the Office of Community Outreach Engagement at the Meyer Cancer Center. And she really took me under her wing and encouraged me to get a master's degree in clinical epidemiology and health services research. And what I'll tell you about, there are a few things I'll tell you about Erica Phillips. Number one is she is brilliant. She has over 20 years of experience in health services research. She is also like guided by this moral compass that points due north, and she's never wrong. And so when she tells you to do something, like, you listen and you do it. And so of course I signed up. I enrolled in the program while I was still working full time as an attending, which was kind of tough, but totally worth it. And, during the program under Dr. Phillips' mentorship and then Dr. Rula Tamimi's mentorship, I was awarded my first grant to fund a pilot study that focused on improving lung cancer screening rates in primary care settings. And the rest is history. I think this is like what really gets me up in the morning and what I get excited about. And I think we're making progress. It's so great to see how far we've come, even since I started doing this work. And I think my intention was really to focus on solution-oriented research. And what I mean by that is this implementation science, which is sort of the science of how we actually implement evidence-based guidelines into practice. It really bridges this gap between what we know and what we actually do. And so this is my passion, and I love it, and I'm super excited about it.
I think that's amazing, because I agree that the rates of screening are so low. And I'm thinking about it in terms of the challenge of getting more screening done in the primary care setting, particularly for those who don't have a history that is, obvious to a lot of doctors, like you have a history of smoking or whatever other risk factors. But I just feel like when we compare the rates of screening to like mammograms or even colonoscopies, it's dreadful. And we could have 10 shows talking about that. But there are a lot of good people like you, and I know, of Dr. Amy Cummings at UCLA, is doing a lot of. I don't know if you know her, but she's doing some great work in trying to improve the screening rates in California through the California state schools. So I think it's really important to have people like you. We need people like you, and others who are, who get up in the morning, and this is what drives you. It's amazing.
Yeah, absolutely. And I mean, I am so just in awe of the work that you have done and how impactful your presence and your voice is, and just everything that you have done, since your diagnosis. I just think it's really cool. And it's just so nice to see so many different people coming together, right? I think I value being able to have these types of conversations with you, and having somebody like you at the table who is knowledgeable, and also you bring your own lived experience there, because as much as we would all like to think we know everything as healthcare providers, we just don't. And I think the assumptions that we make can be really dangerous. And so that's why it's nice to have a sort of diverse perspective, to be able to keep everyone down to earth and really kind of focused on what's important.
Well, I really appreciate that. You're very kind, but really, I learned so much. This is how I learn, by having conversations with people like you, and it's what drives me as well. I mean, I'm by nature a curious person, so when I find guests of people like you that I want to have a conversation with, I just want to, and then I learn. Even today, I've learned so much more about your background and stuff. And you mentioned those mentors, and I love mentorship. It's one of my as a non-scientist, non-doctor, I love mentorship in medicine, and every single guest that I've had on my show talks about that. And so I can see where your young early career right now, but you've had these mentors, and I imagine that you probably are mentoring others already. But how do you see that? Sort of like I always say, someone mentioned to me one time, it's keeping the ladder down, and sort of like bringing up the people from just this sort of chain of how you learn from each other, and then you train and teach others. So how do you feel about that?
Oh, I mean, mentorship is critical. I don't think I would be where I am now. I don't even think I would have been brave enough to even kind of go down this other path without mentorship and without someone who is knowledgeable and, really cares to guide me. It's funny. I have a pretty I'm pretty tough now because when you have a mentor who really cares, you value their like whole truth, right? And my mentors, Doctors Phillips and Osborne and Baba Gummy and Dr. Tamimi, I mean, they did not mince words. I remember the first time I wrote a grant and it was awful. I mean, like, I won't even share the details, but I remember Dr. Erica Phillips was just like, okay, this is a great start, and sort of walked me through like, the skeleton of how a grant is meant to be structured, and I've come so far, but there's no way I would be where I am now sort of 4 grants later and actually carrying out health services research and mixed methods research. Yeah, now I am sort of at the point where I'm paying it forward, and it's so fun to work with young, enthusiastic and curious, like pre-medical students or medical students, and even trainees. And so I always, tell them, like, do not undervalue or underestimate the power of mentorship and just having a community of people who lift you up, but also challenge you and remind you of your sense of purpose when things get really hard. I just gave a lecture at the University of Colorado and kind of talked about a lot of the implementation science work that I do and why this is important. And it was like so cool because all of these residents asked so many questions and they were really engaged. And it was just like, it melted my heart to see how excited people are about these sorts of things. Like, I love it, and I'm glad to see that other people really kind of value this work as well.
Yeah, my surgeon, Dr. Doug Mathieson at Mass General, it's amazing how many people, the common thread of how many people trained under him at Mass General as part of the Harvard system. And it was really interesting to me. It's like, I'm talking to so-and-so and they're like, oh yeah, I know. He was one of my mentors. I'm like, oh my gosh. And these are people that are later in their career and they're still talking about their mentors. But I love the fact that you're paying it forward. You're helping guide the next generation of people like you. And that's brilliant to me. I think it's just brilliant. So,
Well, thank you. And so are you, by the way. I think people see you and they look up to you and they know that patient advocacy is possible. I mean, think about how far we've come. I mean, I don't think there were many people like you even 10 years ago, right? I think that this is something that is like, we're really integrating and we're all kind of coming together, and you are just as much a part of this whole team as the rest of us, doctors and other healthcare providers. So I think that's pretty cool too.
well, again, I really appreciate that. You're so kind, but I agree with you, and I do believe that there is an ecosystem, and everyone has a part to play. Because when I say we're all in this together, I really mean it. I don't. It's not just a buzz phrase. It's like talking about research and saying bench to bedside. Well, the people working in the lab and basic research at the bench, their idea is not going to get to the bedside without a whole chain of events, that need to take place, whether it's investors, whether it's biotech. I mean, there's also, so I'm a big believer. I'm not a scientist, but again, I just continue learning from people like you. So there's just a couple other things I wanted to. You mentioned earlier about it's just sort of being this buffer, and I had a question that I had written down. I was like, I think I would like to hear what you think about like this delivering of good news and bad news. And so that seems to me that's got to be emotionally really challenging, to kind of keep that composure, and whether you're delivering good news or you're delivering not so good news. So what is your sense of that?
So it's one of the reasons I actually became a radiologist, because like I said, I feel like very deeply for people and I'm extremely empathetic. And so it was hard for me to really feel like I was able to deliver bad news in a way that, was, I guess, perfect. And I think I'm less of a perfectionist now, David, because I was so bad at being a perfectionist that I just decided not to be one anymore. But, and so when I was in medical school, like I always wanted to do everything perfectly, and even residency. And there are people who are really good at it. But I also think that, to be honest, we don't always know the best way to do that. And so, I mean, this is sort of tangential, but I want to make this point that a lot of the work that I do, or actually all of the work that I do, always includes like a communications expert, because I think we don't always know how to convey a message in a way that really kind of resonates with people or lands in the right way. And so I'm always learning how to do that. I think radiologists are notorious for when they call anybody, it's typically not good news. Sometimes it is good news, but usually if I'm calling, it's with bad news. What I will say is that, or it's, something that I think is really important and needs to be followed up. Sometimes I do reach out to providers and say, hey, great news. Like this treatment is really working. Like we're seeing this amazing response. But what I always try to do as a radiologist, I'm not typically the one who breaks bad news. That's usually I'm telling the provider and then they're telling their patient. But what I do try to make sure is that, because now we have pretty immediate delivery of our reports to patients through like patient portals. And so I get worried that if I am signing a report that has some bad news in it, I want to make sure that that patient, when they receive it, has support from their provider. And so I will call up the provider and I'll say, hey, I'm about to sign this report. It's not great news. Like, I just think you should reach out to your patient, or I just want to let you know, if you haven't had a chance to talk to them, before I sign my report. And so I try to always think about the person on the other side of the scan. I hope that answered your question.
That's awesome. No, well, you just said it. It's like thinking about that other person. It's like I always say, it's like treating people with empathy. Empathy is one of my things that I really feel strongly about. And because I feel like, well, how would you want that news delivered to your mom or your twin sister? So there's a question I ask everybody on my show. Outside of work, Dr. Groner, tell us something that you're passionate about or that people may not know about you.
Oh, awesome. Okay. Well, first of all, please call me Lauren. And there's no Dr. Groner here. But I would say, there are so many things. I have a really wonderful group of friends, all the way from like, my oldest friend is like considered our triplet. Like we have Allison and Katie and I have no memories without each other, and friends from elementary school and high school and college and just all phases of training. And then other just time from living in New York. But so I really value my personal and also professional relationships, but I really try to prioritize time with friends and family. And then, of course, like, having lived in New York for 12 years, how can you not love all the great food and then the arts? So I love museums. And last weekend I went to the symphony, and I just try to eat up like arts and culture and food, literally, the others figuratively, and time with family and friends. It's like, and then I actually do a lot of research work on the weekends. It's stuff that I enjoy, and it's a time where I can kind of catch up on things. So yeah, and then, I love to travel. I travel quite a bit, and so I keep busy. I have a very full life, and both personally and professionally, and I appreciate that, and I don't take it for granted.
That's awesome. Thank you so much for sharing that. So before we let you go, tell us what's next? What's the next chapter look like for you?
Yeah, so it's pretty, I think, public at this point, where I moved to Miami over the summer after living in New York for 12 years. It was like, some of the best times of my life. And I think really shaped the person that I am now in so many ways. I feel really lucky to live in what I consider, maybe I'm biased, probably the best city in the United States. But I do have a pretty big career move coming up. I am super excited to share more details on that in the coming weeks. And so we'll have to do a round 2, David, where we have like a little catch up session. But really just kind of continuing to grow and evolve and learn as a radiologist and a health services researcher. I'm going to keep applying for grants and keep funding research to improve early detection of lung cancer and cardiovascular disease using low-dose CT. I think advocacy is a big part of what I'm doing. I am actually having dinner with Heidi Anda and her husband Pierre tomorrow. So, because I happen to be in Denver, so it'll be really nice to see them and just, continuing to connect with people who really always reinforce my sense of purpose.
That's
like
awesome.
You also, David.
Awesome. Well, make sure you say hi to Heidi and Pierre for me. They're good
Absolutely.
friends of mine, as you probably know. So, well, Lauren, thank you so much for everything that you do for the lung cancer community and the work through your work and your advocacy and your passion and your North Star attitude. And I really appreciate it. And thank you so much for being on the show.
Oh my gosh, David, it was my pleasure. And thank you for even having me and considering me. And I am super excited to come back if you'll have me.
Awesome. Well, we'll have to do a catching up with Lauren episode.
I'm excited. So anyway, and Lauren and David. Yeah.
Thank you so much. It's great to see you.
Thanks. You too. Bye-bye, David. Thank you.